Hi guys, welcome to my YouTube channel. My name is Justin. If you're new here, kindly hit the subscribe button, the notification bell so that you get notified anytime I post a video. And don't forget to like, share, and comment each and every time we post something so that we got to know what you think about whatever we are talking about in our videos. And for our returning subscribers, asante sana. And on today's topic, we're going to have something like a Q&A for like our daily, what is it called? Mm, Checkups in the hospital and all that. So if you guys have any questions, any concern, or you have like something to say about what we're going to talk about, kindly comment down below. So yeah, let's start the video.
Right. So, hi Justin.
Hi.
So, tell us what has been your experience when you visit a healthcare facility and you meet male medical practitioners.
So, what my experience has been
Mm.
meeting male practitioners when I go for a checkup to the hospital. Well, for me, right now, I'd say at least I'm a bit comfortable than before. Before, I was kind of scared. Like, I'd not want to go to be seen by a male doctor because, like, for some other reasons, let's say I'm going in for things like UTI and all that. I'd prefer being seen by a female doctor than a male. So right now, I think I'm comfortable being seen by a male doctor to a female. That is just my opinion. Like right now, I'd say I'm comfortable being seen by a male doctor or going to the hospital and being reviewed by a male doctor. Yeah.
At what point do you feel like your private space is being encroached? At what point during a medical examination or during medical questions when you are in the doctor's room do you feel like my this one I think now my private space is being encroached?
Well, for me, the times that I feel like my space is kind of being interfered with are the times that I have to do a physical examination. Let's say I have something to do with maybe I'm feeling pain on my breast or having abdominal pains. So at first, I used to feel like the doctor is kind of getting into my space because when you go there, the doctor will obviously ask you to lay on the bed so that he does his physical examination. So you have to like pull up your blouse or maybe pull your pants a little bit so that they examine your stomach. So at that point, I feel like my space is kind of being squeezed. But then I right now I kind of understand why we are being told like Kitambo I used to feel like these people just like this doctor just want to see my breast or see my stomach and all that. But right now I feel that I think I'm more enlightened. I feel not okay, but I understand why they have to do that physical examination. Could be there's a lump or anything, and the only way the doctor can be able to tell is by touching and feeling. So, yeah, at that point, I feel like my space is being interfered with.
Do you are you aware that as a patient you have rights and that you can actually request to have some of these examinations done by a female healthcare provider if you feel that you're uncomfortable with the male doctor? Do you know that there's such a provision?
No, I've not known of that.
Mm.
But so if I'm going in, I can ask for a female accompaniment, like
Yeah. So
somebody to accompany me.
there are two options to it. There's what we call chaperone. So either the male, if you're a female patient and the doctor is a male, the doctor is male, then the doctor can call in a female, either nurse or a female doctor, just to be there when examining you. So we call that a chaperone. Usually the chaperone is an opposite gender. Okay, the gender that you're comfortable with.
So if I'm a female,
So if you're female, the chaperone
should be
female. If that is if the doctor is
male.
male. But remember, in today's world, because again there's this other issue of LGBTQ, even when the doctor is female, there is need to call in a chaperone who is a male doctor or a male nurse to be there when the female doctor is examining a female patient.
Okay. Well, I didn't know that.
Mm.
But if there's that provision of me having to choose to have like a female, let's say a female chaperone
Mhm.
coming in for some kind of examination while I'm seeing my male doctor, then that would be okay. I think that should be the first thing. For me, I think that should be the first thing the doctor should tell me. If, let's say, no, not each and every patient is literate, like, and then remember we all have different perspectives. So I feel as a doctor, when you are going to do like some kind of examination, let's say doing a pap smear, I'd prefer you suggest that to the patient if you feel like the patient is uncomfortable but not able to say. As a doctor, I think you can see that your patient is not comfortable with maybe the examination you're going to do. So you can suggest to the patient, like I'd prefer if my doctor suggests to me that if you're not comfortable, then let me bring in somebody who can, like somebody of the same gender to kind of be there to watch what you are going to do or just to be there so that you feel comfortable. So I think that would be a good idea, though I've never known of that. So for me, that would be a good idea. But then I also fear of maybe having that female. It's like getting into my space again because could be my illness is something that I take private. So having somebody else come in, it will be kind of crowded or kind of exposing myself to somebody else. So for me, I'd prefer just having the doctor alone.
Okay, and so maybe you share with us about which of the many types of contraceptives do you prefer? Which one do you feel that is more convenient? You are more comfortable in trying? Which of these very many contraceptives?
Like the types of contraceptive that I'd wish to try.
Mm.
Well, so I know of condoms, the IUD, the pills, and then this one, the one that they put here. I've forgotten the name. That one, and then there's the other one for injection.
That's an implant.
An implant, yes. And then there's the other one for injection. So for injection, no, that one I'll not go for it. First, because I don't like injection, so I'll not go for that. Plus, you go for it, I think, every 3 months. From stories that I've heard, people say that the one for injection is more painful than maybe these other ones. So for injection is a no. For pills, it's okay, it's convenient, but again, I'd not prefer pills because I don't like drugs. So that one is a no. And that leaves us with three. That is condoms, the IUCD, and the implant. So for the implant, for the condoms, yes, that is an option that I'd try, but it's not effective because not every time you'll be using protection with your partner. That is, if you're married or you kind of live together with your partner, you're not going to use the CDs each and every time. So that leaves us with two. That is the implant and the ICD. So for these two, I think they both have their disadvantages or side effects. The implant one I've had, it can either make you fat or make you grow thin. So I'm about 50-50. I'm kind of 50-50 about that. And then for the IUCD, I'd give it a try. Like, it would be my number one option because we have the non-hormonal and the hormonal ones. Same to the, I think same to the implant, if I'm not wrong. But then for the implant, I think but I think you also have to take, I don't know if it has the hormonal and non-hormonal, but I know of the ones that at least I've researched at the ICD, that I know there is the hormonal, the non-hormonal. So the hormonal ones are used for those who have heavy periods. I don't know, but I'd prefer going for an IUCD because it's it's a one time thing, though the process of maybe having it in is kind of uncomfortable, but maybe for some few minutes, kind of maybe 5 to 8 minutes. And then it's one that after, like, when you want to have more babies, you can just go and get it removed, and then maybe by the next month you are able to conceive. So I'd prefer IUCD unlike the implant. Plus, again, the implant is just somewhere where anyone can notice. For IUCD, it's inserted inside. So, though some people say that IUCD, at when you are kind of having intercourse with your partner, that they can. I don't know if they can or they can't, but I think that would be my number one option because not. I don't know how to say it. The side effects are not much, and then it's effective. You only put it once, and then removing it is also not a big of a deal process. You just go and remove it, then the next month you can conceive. So I'd try ICD. Then my number two would be the CDs, and then number three, maybe the drugs. The other ones I won't try because of maybe what I've heard. They either make you thin or make you fat. That is for the implant. So I'd try ICD. I'd
Okay,
prefer that. That is according to me.
all right. Um what is your take about the use of what you call the female condoms?
Female condoms.
Yes.
What is my take?
Uh,
Well,
w-
well, I've seen them, but I'm a bit confused on how to use them. Like, I would prefer, I would prefer my partner using the condoms instead of me having the female condoms because I feel the process of having the condoms inakaa tedious. It's kind of tedious, and then you have to like really insert it huko ndani ndio ingie vizuri. So I don't know, I would not try it. I'd prefer my partner having this as opposed to me. Like, it's just a process. I've seen it, by the way. I think I should go and buy it and then I try. But then for this time, I think I should research on how to insert it properly. It's the same as using those cups for menstrual when you're having your periods, using the cups. The cups zinakaa like tedious. And then you really have to kunja it vizuri. It's a rubber. Then you it. So I'd prefer just having my
then there
partner
is
use it.
there is there's also another type of contraception that is a biological agent, is a tablet that a kind of you insert it, and it dissolves and kind of makes the environment very uncomfortable or unconducive for the the uh, for sperms to penetrate to all the way to the fallopian tubes to, yeah, they're called spermicidal
Yeah,
tablets, yes.
I've never heard of that.
Yeah,
I'll
that's
go and
another
research.
contraception, but the problem with that is it interferes with also the other what you call the normal flora of the vagina. So sometimes even after using it, you end up having some of these vaginal infections, bacterial vaginosis, urinary tract infections, the yeast infections. So it's one of those least, I would say, is least used kind of a contraception, but it's available.
It's available even
Yeah,
in Kenya.
it is available. Yeah,
Ah.
yeah.
Eh.
Yeah, but people
So
usually,
that one you just
you know,
take it and then so how long, like you
no,
insert
it
it at
is
what time? Like the
it
time
is
you're
at
having
the
it or before?
time the time you the time you're planning to have intercourse. So that means within that setting of having an intercourse, that's when you insert the
How
tablet
long does
because
it
it
take to
quickly
dissolve?
dissolves and forms. It's kind of there's a solution that it forms which is kind of thick.
It's not itchy.
No, people react differently to this kind of contraception. The same way people would have a reaction to latex, that's the same way they would react to these biological agents.
So
Yeah,
the
but
people
it's
who react
convenient.
to sedis, like
Yeah,
the latex
latex,
itself.
yeah, it's there. People have reactions to this.
So at what point do you know you have reaction? When you are
You
feeling itchy while you
you
having
will
intercourse?
have discomfort during intercourse and after the intercourse. So you are able to tell that this is because of this, because most of the times this kind of female this kind of people have not used that kind of latex before, and they tend to react to it. The body just has a natural way of rejecting things. So when it feels like this one no, then you end up having those kind of discomfort. You itch a lot, you can actually develop some rash, some
So is that the
discharge.
same way somebody will also react to these IUCD and implants?
Okay, the IUCD, you don't react to them. What happens is you have interference, especially the hormonal ones will interfere with your flow. There are those that will make it very, very heavy. There are those that will make it you not even see menses at all.
Yeah,
So
I've heard
that's
of
not a
implant.
reaction really.
Implant, I've
Yeah,
heard
it
there are
just
people
interferes
who,
with the way your hormonal profile.
and for the implant, if you don't see your menses,
For the
is it
implant,
100% that you can conceive once you
actually,
get it out?
implant is one of the safest, I would say, one that provides almost guaranteed contraception because it provides between 85 and 92% coverage. So it protects you to a very large extent as opposed to these others. The least, of course, being the least you've had is
The least for you
the
to
one which
get
is
conceive after removing it,
no, the one
after
which
having it,
the
the
one who
injection
has
one,
high risk of conceiving while you're still on the contraception.
the medicine.
Yeah, the medicine, because again, for you see
And
the
then you can't
medicine,
be
the thing is you can
consistent each
easily
and every
call.
time.
Yeah, you consistency is an issue. Today you'll take it at around 10 p.m.
So you
Tomorrow
need
you'll
it
take
to
it
take
at
it at
8
the
a.m.
same
It's
time
supposed
each
to
and
be
every
at
day.
the same time
Each and every
for the
day.
duration that you've been given, because they're usually given in packs. So if you forget even one day, then you are at risk of conceiving. The IUCD also has its own flaws. Again, it's not that perfect, but it has a lot of flaws. But I think for the reason you mentioned about convenience, it really fits in. Again, it serves you for a longer duration. You don't have to go and remove. You see, like for the implants, you have the 3 year and the 5 year. So after 5 years, you have to go and change. And most of the times during the time when it's almost expiring, it usually brings a lot of discomfort. Sometimes your period starts, they become heavy.
So
So
for
but for the
IUCD, I've
IUCD,
heard
you
it takes around
take out
10
10
years,
years. You don't have to even go
but you
and
can
change
remove
anything,
it
but
in between.
you need to be going for your routine checks, because there are times you put an ICD and it disappears. It burrows into the skin. Then you are in problems because you
I've
start
heard of
having
people who
pelvic
conceive with
pains.
the
Yeah, it's
IUCD.
possible. The ICD can be there,
Is it
but
because it has expired or it
not
has
really.
just
It's
been misplaced?
just displaced, not misplaced,
Displaced.
displaced from its point where it's supposed to be. So when it's slightly displaced, then of course you will definitely conceive.
At least now
Yeah.
I know when you have the IUCD HID, you should be going for your routine checks
Mm.
to at least check if it's still in place.
Yeah, that's very important. Yes.
And